and it's kind of a quick thing to do if, you know, while you're having the patient sitting, and it's something that you can start with. So you quickly either flick the tibia into external rotation or internal rotation. So it's just, they're just sitting there, and then all you do is you just flick, okay, like that. I'm just flicking their foot into their tibia into external rotation or into internal rotation. All right? And again, external rotation goes with medial meniscus. All right? Internal rotation goes with lateral meniscus. It's that simple. All right? And then, so remember, we're looking for joint line pain. So, you know, they're going to be at the end when you do their palpation, if they have a posterior horn tear, you know, you're going to take your fingers and you're going to push along the joint line. That's right where, you know, her meniscus is right in there. All right? Okay, good. McMurray's. Go ahead and slide back. I was just thinking, I was referring to it. Okay, so McMurray's. So medial meniscus. Okay, so with medial, which way does the tibia go? External. Okay, and then a valgus stress. So what you do is, all right. So what you're doing is a valgus stress, external rotation, and then kind of work in flexion and extension. All right. You kind of put your fingers over this area to kind of see if you feel a click. So a positive sign would be pain to the medial joint line, or a click or a pop at the medial joint line. All right, and you're just kind of doing that. All right, as opposed to lateral. Okay, so you do an internal rotation of the tibia. All right, and then you do a varus. So you kind of see people, they might kind of circle around like this. All right, they're just kind of, all right, just kind of going into flexion and extension. As long as they have a good hip, right? He needs a pretty good hip to be. All right. So external rotation of valgus stress, and then working into flexion and extension. All right, just trying to see if there's a pop, a grind, pain. All right, and then internal rotation and varus. All right, bounce home. So basically what you do, you know, is you're kind of talking to the patient, well, yeah, it's pretty bad that you hurt your knee. I hope everything's all right, okay? All right, and then just kind of do that. Okay? And then you're looking for joint line pain, right? So, you know, she'd say, oh, that hurt, you know, right here. You know, she'd point here. Or, oh, that hurt right here. Okay? She said, oh, that hurt here. Oh, that hurt here. Okay, that's not positive, right? Joint line. Okay, and then Apley's. Don't know my sign language yet. All right, stabilize at the distal femur. 90 degrees of flexion. All right, we put an axial compression, so I'm pushing down. All right, and then I can externally rotate for medial meniscus, or I can internally rotate, okay, for lateral meniscus. All right, so you don't go, you know, through the whole internal external rotation, right? You test one with external and kind of repeat that a couple times, 3 or 4 times. All right, and then you go into internal rotation with that axial compression. All right. There's also, we won't talk about this test. There's also an Apley's, just so you know. I don't really